I think our biggest concern right now is how are we going to continue to expand our services with the limited resources that we have. For example, the emergency department, we've got a plan for expanding our emergency department to be able to accommodate 120,000 patients. Because eventually, I think that's what's going to happen, is you're going to see some consolidation in Hudson County of healthcare services, and more patients are going to come here. Well, that ER is built for 50,000. If we're starting to see 80, 90, or 100,000 patients, we're going to have to expand it. What that means for us is that we need to be able to continue to expand our campus to really meet the needs of the patients and the volume of patients that will come to our facility.
Good morning. How are you? Good to see you. Robert, good to see you. How are you? Good to see you. We are the only hospital in Hudson County that have the NICU unit, intensive care nursery. My biggest fear is adverse outcomes. Babies that have asphyxia, my heart goes for them. Babies that have significant complication, bleeding in the brain, significant infection, which is very rare, luckily, nowadays. These are the things that I don't like.
We treat the babies who are most sick and most vulnerable. We actually have children transferred from other hospitals within Hudson County to our regional perinatal intensive care center and to the neonatal intensive care unit. So every day we're treating really the most vulnerable population in Hudson County.
Veronica came as a premature baby, and she had her own risk of breathing problem. She required IV nutrition for a long time.
She was really preemie. She was almost 2 months preemie. And I was worried about her because her weight was 3 pounds and 10 ounces.
There was an issue with also her size of her head and the ventricles inside the head, whether they were really growing or not, because they were really like bulging up, and we worried about if she's gonna progress into what we call hydrocephalus.
She was so tiny. Oh, really horrible and scary for me.
We work as a family, as a team, approaching those parents, and we do understand what they're going through. Like this. Veronica is a beautiful sample. Oh, she's so sweet. I'm gonna miss you. I forgot that grew from being a premature baby and a sick premature baby into such a beautiful girl. Bring me so much happiness, so much, I get so happy, when I see them.
Well, every parent wants the best for the kids, right? And I think the Jersey City Medical Center is this place.
Yeah.
It's too tight.
Yes, I'm so big.
We have a terrific EMS service who have really worked on developing a national standard for transport time. About 4 years ago, the average time from when a call came into the 911 center to the time we picked up the patient was about 10 minutes. We've been able to reduce that to 6 minutes. Those 4 minutes are critical in making sure that patients get treated in a timely manner and actually save lives.
A day later, and 2 officers remain in critical condition at the Jersey City Medical Center, both lucky to be alive.
He had a bullet in the middle of his neck, right next to major vascular structures, next to the carotid artery and jugular vein.
Once I was hit, I was dragged out of the building, but from what I understand, EMS, very brave people of EMS that we have here. Once they heard the gunfire, they ran toward where we were and started to package us up and bring us to the hospital.
There's something we call the golden hour in the in the trauma speak, and that's the first hour after the patient presents to the hospital.
We're talking hair whiffs away from dying. If another millimeter or so, I probably would have bled out in that building.
Our team is here 24 hours a day, 7 days a week. We are on call in the hospital, and when these patients arrive, we are there waiting for them.
The hard work of the EMTs, getting me here safely and promptly, and the emergency department downstairs, and the surgeons, and the intensive care nurses, and everybody that took care of me for my entire stay. It basically saved my life, and I don't know what I can ever say to these people,
The biggest challenge and difficulty of caring for trauma patients is you never know what's going to come in.
Witnesses tell police they thought two vehicles collided here at 6th and Marin. That's how loud the impact was. Jersey City police say the driver tried to beat the light at the intersection of Marin and 6th Street seconds before mowing down a pedestrian who had the right of way.
I broke bones everywhere. She thought I lost my left eye. The brow was broken, and it had, pretty much.
So you had damage on it?
Yeah, damage to my face. That damage to my legs was, pretty tremendous. That the legs looked like two bruises.
He arrived in our trauma bay in excruciating pain. We were able to immediately get him to CAT scan, confirm that he didn't have any life-threatening injuries in his chest with a chest X-ray, and then shortly after getting back from CAT scan, he crashed on us in the trauma bay.
Then they realized that he was bleeding internally, and so they took him immediately to the operating room.
I had to open his abdomen twice in the ICU because he was too unstable to go to the operating room. Open his abdomen because he was just pouring blood out. I went to her and I told her, we're doing everything we can. We're giving him everything he needs. And if he doesn't turn this around in the next several hours, within 24 hours, we know that it's probably going to be futile.
We know each other so well, and I know that just by touching him, he wouldn't know whether I would have fear or, any insecurities, or I didn't want to bring any negative by the touch. I just touched him, and I wanted him to feel secure, like he always made me feel.
That morning, I was like, listen, if he doesn't turn the corner, if he doesn't stop bleeding on his own, we're going to end up having to call it, because right at this point, we was on full life support. It was all our drugs, all our medicine, keeping him alive.
From the very beginning, they, were calling me the miracle boy. Those were the first words that I heard when I gained consciousness.
Everyone took care of him when they should, at the right time, right place. He got what he needed to get, and that's why we saved him.
I don't recall exactly what happened, but I have the scars to remind me. It's all still there and visible. So, I'm constantly reminded of what was done by the Jersey City Medical Center's trauma unit to save my life. I was born basically twice at the medical center.
What I find the most compelling part of Jersey City Medical Center is the people, the dedication, and the camaraderie into making this place truly a great provider for healthcare.
When it comes to trauma, when it comes to our emergency medical services, when it comes to cardiology, or our regional perinatal intensive care center, there is no better place to get care than at this hospital.